Okay, so we'll go ahead and get started. Good afternoon, everybody. On behalf of President Mason, I want to welcome everyone to the 2022-2023 first town hall of the year. I've actually tried to think about different names to call this town hall because we're actually be talking about some other things besides COVID. And it's not just going to be a COVID town hall. Unfortunately, we have another community health crisis to talk about a little bit, monkeypox. But also, we want to shift the focus a little bit onto wellness. So I've called this our community public health and community wellness town hall. And we'll talk a little bit about the ongoing shifts and pivots that we want to continue making throughout the semester and the academic year. You'll hear about some updates that we're making in our protocols in responding to and living with COVID. Mr. Bako will be talking about that. We'll be clarifying some of the shifting protocols that we're hearing more about in the district and thinking about what it means to learn to live with COVID, right? We're coming to a point where even with the different variants, we're coming into cooler winter months and we're waiting to see what the virus is going to be looking like in the cooler seasons. But we are going to close out today's town hall talking about a community survey that we're going to put out about thinking about what the spring is going to look like. And we want to get your input and the community's input on how we should be thinking about what it will look like for UDC to live with the reality of a virus like COVID into the future. We also want to welcome the new VP for Human Resources, Ms. Lorenza Bridges-Key. She's going to be presenting some updates from Human Resources. So some of you joined her job talk when she was interviewing. So we want to congratulate and welcome her to this forum. But without further ado, I want to turn it over to Alex Bako for him to review our institutional statistics and bring us some updates about our changing protocols. Alex?
Thank you, Dr. Guillory, and good afternoon, everyone. I hope everyone had a pleasant, fun summer. I think our last town hall was a few weeks before commencement, and then there was a short spike in the way in the number of cases, both through the district and at the university, and then things have been kind of smooth since then. But the fact is, even though the mayor's not emphasizing COVID so much anymore, and the CDC has moved on to monkeypox and even polio and things, COVID's still out there. It's circulating, and excuse me, and there are sort of continuous cases going on. The good news is that because the vaccination rates are so high in our community, it seems that there are very few hospitalizations and even fewer deaths. The downside is that people are taking their masks off and people are getting close again, and the new strains are even more contagious than the previous ones. And so it's still circulating in our community. If you look at the left table, you'll see that prior to the summer break, we had 110 cases. And then on a weekly basis, you can see that there's all single digits, but even though they're single digits, there are a couple of sixes and sevens in a particular week. And so it's sort of gone that way all summer long. So we have 169 cases total since the beginning of the pandemic. And that I think that's a good thing. I think it's good that the numbers are dropped down to these single digits. That wasn't the case earlier in the year. And on the right side is the district COVID data around approximately the same period. And you can see that again, there was a spike early part of the summer, and then even in the district, the numbers are going down. Even on September 3rd, that week, it was the lowest ever. Not the lowest ever, but the lowest through the summer. And those are per 100,000 population. So it's approximately 700,000 people residing in the district. And so if you want the raw numbers, you just multiply those numbers by 7. So it looks like things are trending in a good way, but there's going to be little hills and valleys as we go forward, especially in the cooler months. So that covers that. If you have any questions, please put them in the chat box and we'll answer them when we get a chance. Next slide, please. Okay, so the district, because of a DC Superior Court decision earlier this year, lifted the vaccination and masking mandates for DC government employees and for agencies. The new employees do not have to be vaccinated. There are some exceptions to that, and certainly religious and medical exemptions are not required or accepted anymore since there's no more mandates. So I guess that was a legal thing that was decided in the courts. But my interpretation, or what's been explained to me, is that the university is not required to adopt this ruling because and the short answer is that the university doesn't fall under the direct control of the mayor, and so we can choose or not choose to do what we want to do. And the university, and upon recommendation by the COVID-19 task force, thought it would be best, at least for now, to keep the masking and vaccination requirement in place for students and for faculty and staff. We'll continue to review that issue and we may make different recommendations in the future, but for now, everything stays in place. Next slide, please. Did we skip one or not? Yes. So the CDC, again, earlier this year, changed their guidance and they made the determination that someone who tests positive can end their isolation, otherwise saying return to school, return to work, without a negative clearance test. So, with that said, if you do test positive for COVID-19, as previously required, send your positive test result to COVID Confidential at udc.com. It's been the same throughout the pandemic. And you can send it in the form of a lab test result, or if you use a home test, you need to take a photo of the test strip with your name and date in the photograph. A lot of people don't do that, and I have to get back to them to verify that they send in a valid positive test result. So please pay attention to that. If you do test positive, that's what you need to do. I don't want to come back to you and say, I got to do this, I got to do that. Just I wish everybody would just get into the habit of doing that if they do get sick. And so for returning to campus, again, you don't need a clearance test result. Now, you can take a home test result, and the university provides them. And when it's negative, you come back to the campus, but you don't need to. If you're asymptomatic and if you're fever-free for the past 24 hours, after day 5, you can return to campus on day 6. So, or if it's day 6, day 7, day 8, all the way up to day 10. If you're still symptomatic, if you still have a fever, if you have vomiting or diarrhea or something, one of the more severe symptoms, after day 10, we recommend or require that you go to your healthcare provider and get an evaluation note. Find out what's going on. Let your healthcare provider determine when you can return to campus. All right. If anybody has any questions about that, again, please put it in the chat box. And everything else regarding our protocols remains the same at this time. Next. I just put this in there because oddly, I'm not afraid to say that to notify everybody that I had COVID myself, and that it was actually one of the rare kind of more severe reactions, and kind of took me out for a few weeks. But masks continue to be a frontline defense against COVID-19. I used a mask the entire summer, and so I don't know how I contracted it. My doctor said it's just the severity of the strains that are out there. But I just want to emphasize that masks are still mandatory indoors while on campus. And there seems to be so much noncompliance. People are just not thinking about it. People are maybe misinformed that it's not required anymore. And so I encourage everybody to please remind others if you see them not wearing masks, or if you see a group of people not wearing masks, and just get back into the mindset of masks are still required at UDC. And I think that we should, I'm going to recommend that we actually place some signage around campuses and maybe in buildings, entrances, just things, hey, this building requires the usage of a mask. And so with that said, I think I have one more slide, two more. Yes, this is my final slide. So um, because we don't require a clearance test, we've updated COVID confidential at udc.edu. You're now going to receive an automated message. I don't know if this is in place now, if it will be tomorrow, or certainly by early next week, but you won't get a personal response. Um, but you can, someone, myself or someone else, will be still monitoring COVID confidential, because we have to tally the numbers and provide them to the district. At least now we do. And sometimes, again, people will have issues with not submitting their positive test result properly, or they may have questions, and so somebody will still be um, looking at that website or at that inbox. And so um, just be aware that you're not going to get a direct personal response when you first submit your positive COVID test result. All right. I hope everybody has a great semester, and let's keep doing what we can to stop this thing spreading through our community. Thank you.
And let me just clarify that really quickly, Alex. We were trying to set up an auto reply to COVID confidential, and embedded in the auto reply would be a link to a survey that everybody would be asked. And it's basically to help us monitor all of our positive cases. Like Alex said, we are still required to report to the office of the mayor all of our positive cases. The issue we are running into is the auto reply set up with COVID confidential, and we're working with IT for that. But Alex and I will work on that, and we probably can just start embedding in our responses with COVID confidential the link to the survey. And we can also put the survey link at the RISE website. So, we need to capture all the information for people who are positive, the date when you're reporting your positive test. We still need the copy of your positive test in case you want to use your COVID leave. So it may not just be an automatic thing. We thought we'd be able to just put an auto reply on and embed the survey link in the auto reply. We're just running into some issues with that. So we'll maintain some communication and update communication about when that goes automatic for the COVID confidential survey. Okay. I think academic affairs.
Good afternoon, everyone, and welcome back. I trust that each of you had a wonderful summer break while many of us were preparing to help reopen the institution for everyone's safety. Let me just underscore that from the academic affairs perspective, the university has not lifted the masking policy. And so face masks must be worn properly at the university when you are inside campus buildings. Masking is not optional. Not optional for students, not optional for faculty, not optional for staff. Masking is not optional. The university has invested in 28 mask dispensers to make masks available to those individuals coming to campus who either left them in the car, left them in a purse, left them on the nightstand. Our OPSMS team and the Office of the Chief Operating Officer have been very diligent to identify mask dispensers that have been placed across the campuses such that masks can be accessed. They're free and available. But I want to underscore in the classrooms and laboratories and studios and indoors, masks are not optional. This is not to suggest that faculty become the mask police in their classroom spaces, but a faculty member is given the authority to ask a student to leave a classroom if they are not wearing a mask or face covering. If that student chooses not to be compliant, the faculty member has other options to follow through. And so it's my hope that members of our student government associations and other functions across the organization are reminding students that masks are not optional. Our instructional mode this fall We have about 55% of our classes that are face-to-face, a combination of hybrid courses, whether that is high flex or the standard hybrid, and online at about 10%. The course mode is not flexible, and faculty are not authorized to change published modes approved by the university. That would be a violation of institutional academic policy, and faculty are assigned to teach in the mode and sections that have been agreed upon. We have been notified by a couple of students that their faculty members are saying, oh, we're going to be virtual the rest of the semester. If we find that, that is a violation of your faculty responsibility and contract, and this office will follow up with it. Fall opening convocation is on next Thursday, September 22nd, in the Theater of the Arts here on the Van Ness campus from 10 o'clock until 11:30 a.m. President Ronald Mason will be the keynote speaker, giving a State of the University address of sorts, and we encourage all of the faculty, staff, and students who are able to join us in the Theater of the Arts. Masks are required. They are not optional at the fall opening convocation. Following the fall opening convocation, there will be a building dedication at the Old Congress High site, and information about that building dedication, which I know there are a week of activities that are scheduled, can be found on the website. Our midterm exams are October 11th through the 17th, and all faculty are required to submit midterm grades for students online by October 19th. I want to underscore again that all faculty are required to submit midterm grades for students online by October 19th. This gives us a Windows view based on student performance, and more importantly, it gives us a Windows view to fully understand where interventions are needed, where we can capture students in the right moment to try to make sure that they are persisting and progressing towards completion of the course, the sequence, and their degrees. This is a matter of retention, and faculty have a responsibility to submit those grades so that the appropriate interventions can be canvassed across the organization. The last day to withdraw from classes with a W grade is November 1. Students who need to withdraw with a W grade, that process is online and the deadline is November 1st. Spring break will be March 6th through the 12th. In 2023. And so it would be really important for students to know when spring break is. I would also say that registration for our spring semester will begin on or around November 1. So students who are registered for this semester should already be talking to their academic advisors or their professional advisors about courses that they want to take during the spring semester. The registration for continuing students opens on or around November 1st. We will have our annual university-wide research week, April 3rd through the 8th. That includes a Saturday because we are working with one of our federal agencies to have a STEM day on Saturday. And commencement is May 13th, 2023. Those are all of the announcements for academic affairs.
Next, we'll hear from SDS. Is Dr. Latham on or Dean Williams?
I am. Thank you, Dr. Guillory. Good afternoon, everyone. Again, welcome back to campus. Welcome back to this semester. Excited to see students back on campus and really look forward to having a robust student engagement process this year. For student development and success, as Dr. Powell just mentioned, we are obviously enforcing the mask mandate in classrooms and outside classrooms and all campus spaces, as was noted there and is reiterated on this slide as well. Students granted medical and religious exemptions are required to upload their weekly test results via this link that is provided here. And that, again, note testing sites and rapid testing locations throughout the district can be found at that coronavirus.dc.gov/testing link that's listed here in the deck as well. But again, students granted medical and religious exemptions are required to upload weekly test results. Masks are required for all events, i.e. athletic events and student activities as well. So again, for all those activities revolving around athletics, we will require masks to be worn for individuals on those particular events and student activities as well. A text message will be sent to all students via Navigate regarding the enforcement of the mask mandate, particularly in classrooms. Navigate is our advising platform that we use to obviously inform students of different obligations around their advising relationship, but we also use it for various registration processes and other mandates as well. So this will be used for that mask mandate also, to inform students via text that the mask mandate is certainly still in force. Next slide, please. We wanted to provide some financial aid updates to inform the community at UDC as well. Fall aid began dispersing Tuesday, September 6th, and will disperse daily for eligible students in terms of financial aid disbursement. Allow obviously the Office of Student Accounts up to 14 days to issue any refund that may be due to you, which is our standard protocol for the Office of Student Accounts, to give them that 14-day window to get that refund back. But let us know if you have any issues. Contact us directly if you do have any issues with the refund process, and we'll make sure we get that handled accordingly. Fall DC Futures list received from OSSI, and so we're going to go through that list. As DC Futures is a new program initiated with the mayor. We're very excited about the number of applications we have for that. But we have to go through and certify that list and determine eligibility requirements for those who have applied and been accepted to that program. So we're going to do that within the next few days and notify those particular students in DC Futures accordingly. And again, you will see the invitation to apply for emergency assistance up to $2,000 there, and prior balance assistance up to $1,500 next week as we go through that and scrub that list of eligibility for the DC Futures program. CARES emergency aid is limited, and available funds will be automatically posted to all student accounts via our MyUDC portal by the end of September. So again, we want to make sure that those students who normally have received CARES know they will receive the disbursements by the end of September via their MyUDC portal, as has been the case for the last few semesters that we've had CARES availability. And if you have any assistance, again, for any of those issues around financial aid or other student success matters, please call us via our 24/7 365 hotline there, listed 202-274-5941, or email us at findaid@udc.edu. Thank you. That concludes the presentation for student development success.
Next, we'll hear from Ms. Bridges Key with updates from Human Resources.
Thank you, Dr. Guillory. So what I'll be presenting today, employees were required to upload their COVID-19 vaccination documentation by August 18th. To date, we have about 800 entries in the system, and what we'll do is compare that to the entries that we had last year in Paramed. We'll also be reaching out to the employees who have not uploaded their documentation in PeopleSolve. We have about 17 employees that have vaccination waivers. They are required to participate in the weekly testing. Trina Bruce is keeping up with that. She's tracking that information. Those individuals need to contact the health center for their testing appointments. Also, the district's COVID-19 leave policy has been extended to October 1st, 2022. In order to utilize your COVID leave, you must register with COVID Confidential and upload your positive test. Next slide. Headspace, most of you may be familiar with this. This is a benefit that the university pays for our employees. We are committed to helping our students, faculty, and staff by promoting wellness in the university. It's still available through the end or the remainder of this year. It is a user-friendly app that offers guided meditation, workouts, breathing techniques, social connections, tips for interacting with your kids, and other tools to support personal and professional well-being. And the app is available to all students and employees at no cost. So we have about 100 plus employees that are registered to date. And there is a link that we can send for you all to join. So if you have any questions, you can send an email to headspace@udc.edu. Thank you.
And this is just a reminder that this presentation will be posted at the RISE website. So all of these links and whatnot, where it says join here, you can use this link. These links will be live in the presentation, so you should still be able to use these links. But I'll be working with Lorenza and the HR team to hopefully rev up some of our efforts to increase our enrollment in with Headspace. This is a wonderful resource that is really underutilized at the university right now. And like Ms. Bridges Key said, I don't think we have extended or built our enrollment since last year, but we have it through, I think, January 18th. We had a year subscription. So there's still some time for people to make use of that subscription to this wonderful resource. Let's see who we have next. I think it's facilities, yes. Chief Colmer and Mr. Dusan.
Good afternoon, everyone. I just want to share a few things regarding the rapid COVID test that we have, the supply that we have on campus. Our current expiration dates have been extended to January 20th of 2023. One of the questions that I've been getting recently is who authorizes those expiration date changes. Those changes are actually authorized by the Food and Drug Administration. Manufacturers of the test can show proof to the FDA that the tests are actually usable beyond what they originally stated. And once the FDA reviews that test and data, they'll authorize some cases 6-month or 8-month extension. This is our second extension on these tests. And so now, again, we're going out to January 20th of 23. I'm going to put a link in the chat that you can access so that you can look at frequently asked questions and also have direct access to see the information that I'm sharing with you as far as the new expiration dates. Another thing to support our mask mandate, as of today, we have installed 28 hand sanitizing mask dispensers throughout the system. They are located generally at the main entrances or the areas that we have deemed are the main entry points for all of our buildings at Van Ness, Bacchus, Congress Heights, and at National Airport. That is all I have.
And good afternoon, Firebird community. My name is Javier Dusan. I'm honored to serve the UDC community and to represent today the Facilities and Real Estate Management team. Two things that are linked, of course, that I wanted to present today has to do with the cleaning protocols. And we have been maintaining and continue to maintain the high standards of cleaning protocols throughout the campuses. We use products containing soap and other detergent to reduce germs on surfaces. Of course, we clean high-touch surfaces at least once a day. And for areas that are more frequently used, we do it several times a day. And this is something that has come up and will come up, hopefully not too often, has to do with the deep cleaning following cases of monkeypox. And of course, COVID as well. We work very closely, facilities team, with the health center and the different departments and to isolate those spaces where cases have been identified. And those spaces are then scheduled for deep cleaning, disinfection, soon after there is a suspected or a confirmed case. So we don't wait necessarily for the case to be confirmed. Once there is a suspicion that somebody with monkeypox was in the certain space, we work with the departments to isolate the space and then provide the deep cleaning services. That typically is done within the very next 24 hours. We do it as soon as we feel it's safe to do so. Um, Typically, it's also at night, fewer people in the spaces, and then we'll confirm the following morning that the space can be used. That's it for me. I want to reiterate that any questions that you may have, please feel free to reach out to the facilities team, and I'll put the contact information in the chat. Thank you very much.
Thank you, Mr. Dasan. So we just want to kind of follow up a little bit on that update. Oh, okay, get my video working. We did have one confirmed case of monkeypox over the summer, and we just want to make sure people, kind of don't conflate these two public health concerns. And I know Mercy Ojumu is on the call, and we've discussed monkeypox on our task force meetings. But people need to understand really distinct differences between these two transmittable diseases, that monkeypox is not airborne, that per the CDC, just maintain proper hygiene, washing hands. The way you contract monkeypox is through close physical contact. And it is not infectious unless the symptoms are very clear and evident. And in our case, the individual who was infected was not on campus with any symptoms. We are closely monitoring the district's response to monkeypox, and we have expressed interest with DC Health in offering a monkeypox vaccine on campus. So we're closely watching the situation, and we just urge everyone to, practice their own careful hygiene practices and keep themselves safe in these instances. And then the other thing we want to talk about is a COVID-19 survey that we're going to be issuing this fall. I know that Jay is going to post it in the conclusion of this town hall. And this is different than the survey that's going to be a part of our COVID confidential monitoring, okay? One of the things we want to try to like I said initially, is, checking the pulse of our community, even just looking at the chat. There's some really interesting feedback that we're getting about people's sentiments about why are we still monitoring this? Why are we still doing certain things when obviously the vaccine has worked, but some people are still very concerned. People have had very real impact from COVID. There are deaths that people have experienced from COVID in their own families, in their personal close circles. And, we want to gauge the pulse of where people are in thinking about potentially waiving the vaccine requirement moving forward. We know that the district has waived their vaccine requirement, and there are increasing numbers of institutions of higher education that are waiving their vaccine requirement. And we want to just get some feedback from you all about how you feel. And it's the part of the reason why we are doubling down on our mask requirement. We feel that we can't kind of open the floodgates on all of these things all at once. So please take the time out to complete the COVID-19 survey that we will be circulating in the next few weeks. It'll be available immediately following this town hall. But share your thoughts with us. Like I said initially, we will come to a point where we will have to learn to live with COVID. And we know that there are still students and potential employees that we cannot admit to campus because they're not vaccinated. It is a personal choice that they're making. And we want to have a better sense of where our community is with the vaccine requirement. So please, please complete the survey and give us your feedback. We will be continuing to update RISE. We will put this presentation at the RISE website. And now I will briefly entertain some questions and look at what has been posted in the, in the chat, because I just received an announcement from COO Franklin that the Van Ness campus has no water. DC water has been shut off from most of the buildings on the Van Ness campus. And so we will probably have to dismiss most students and employees. An announcement will be going out because there will be no running water in the facilities for the remainder of the day, most likely. So probably on the heels of this town hall, you will be receiving an announcement that because of the water situation, we will be, discontinuing business on the Van Ness campus. So I think Leanne and her team will probably be working on that announcement. But we do want to at least look at some of the questions in the chat really quickly, if we can, if people are willing to do that.
Dr. Guillory, thank you for bringing that up. Yes, we're dealing with that water issue on the Van Ness campus.
Yes.
It will not affect buildings 42 or 40 to 50 or the law school building.
Okay.
So those two buildings are not affected. But yes, a notification will be going out shortly.
Okay. And so any building where people are impacted, obviously, those those buildings cannot remain occupied, obviously, right?
That's a recommendation, yes. That includes the student center as well.
Okay. So we'll look at some of the questions. One of the questions, and this is an example of what, why we need the survey. One question we have in the chat is, if all the government agencies throughout the United States and DC are moving on from COVID regulations, why are we spending energy and resources fighting something that all data says that vaccination, which is also required, mitigates the threat? Okay. And yes, we definitely, when we look at the science, we do see that the vaccination has worked so far, and it has helped to, even with the strains, they are certainly more infectious and whatnot, but we do see that there are organizations, communities are kind of moving past this real reactionary COVID moment. But we also do have to respect people's concerns, fears, anxieties about COVID. And that is part of the reason why we want to hear your feedback. We did want to correct the email address in one of the slides. The correct email is covidconfidential@udc.edu. I think one of the email addresses said udc.com. It is udc.edu. We also want to point out Dean Erica Smith from the law school is here. If there are law school students and faculty, please make sure you check with the law school. We will make sure we include the link to the law school portal for their guidance. All law school students and employees are required to test weekly, and the law school has been managing and maintaining their own kind of protocols around their enforcement. So we make sure that we always reiterate that if you are affiliated with the law school, to be sure to follow their guidelines and guidance. We do count any positive cases from the law school in our totals because we're required to do that, but we want to make sure that the law school is directly looped in and informed of what is happening within their community and empower them to manage their cases carefully. Again, someone from the chat says, we need to be sure that we clarify that we are not going to eliminate COVID, but we just mitigate it. It's not the same as eliminate. Two members of my family died from COVID. One person made a point to ask that the people who are serving food to students wear their masks. So we'll make sure that we point that out. Everyone who is in public spaces on campus, on any UDC campus, should be wearing a mask, especially if you are interacting with the public. And certainly if you are interacting with students and serving them food, you should be completely masked with your mask covering your nose and mouth. Another individual in the chat is asking for clarification about COVID Confidential. Instructions are unclear because it says to send an email to COVID Confidential, and then you will receive a survey with a link to upload your test results. This is why I never sent a picture with the 3 emails I sent with no responses. Please confirm the exact process. Will we receive a response with a survey link, or do we simply only send a picture of the positive test result? So let me clarify this. And part of the reason why we are using a link, an auto response with a link to the survey, is because it became very difficult for us to manage individual cases. It would be a matter of us having to really record exactly when we got the email from an individual, track how many days it had been since that individual had said they had been positive for COVID, whether they were working, teleworking and whatnot. And so it was very difficult for us to individually manage each of those cases, let alone if someone who was responsible for managing those cases came down with COVID themselves or had other things that were going on. So the way we are setting it up now is the expectations that you would still email COVID confidential, and it would automatically send you a link to complete a survey where you basically identify, sometimes people would email us and just say, I tested positive for COVID yesterday. They wouldn't tell us whether they were a student or employee. We wouldn't know whether they, lived in the apartments across the way. We wouldn't know any information about them. So the survey gives us a lot more information about how we can assist you and support you, whether you have symptoms or not. We need to know these things so we can know how to best support you as you recover from being positive with COVID. So we want to improve the system. We want to make sure that if you are testing positive for COVID, that it will be responsive and it's not kind of just left to individuals to be responsive. So once we can capture all that information about who's positive at a given moment, who's been positive for 5 days or more, who should be returning, it'll be easier to manage that through the survey responses. Someone is saying the mask mandate is ineffective, and unless the mask mandate is ineffective and useless, and Alex had reported that he had caught COVID even though he had been wearing his mask. All other entities in the city have dropped the mandate, and the data you just showed proves that is a viable response as the infection rate has dropped by about 60%. And that is very plausible, that indeed, because of the vaccines, because of the mask mandates, and some people are still adhering to their masks. I think that because there are some concerns about people with pre-existing health conditions, we will still, at least for this semester, maintain the mask mandate and maintain the vaccine requirement. But we are considering, at least for the spring, waiving the vaccine requirement. We probably would not drop everything all at once. Because of the mask mandate, we also saw the percentage of flu infections drop. So we know that the mask has been effective in the reduction of the transmission of not only COVID, but of the flu as well. So, we do know that a lot of people do still wear their masks. So, right now it is a requirement in all indoor and public spaces, and we are asking everyone to help us enforce the mask mandate. Again, indicative of the varying opinions, someone else is posting, it's selfish to ignore other people's feelings of fear of COVID. Again, mitigate is not the same as eliminate, and we respect the way everyone feels about the virus. Let's see, the staff, about the people making lunches. We need to make sure everyone respects the mask mandate. Let's see if there are any other. We'll put the link for the law school portal. Somebody's making a good point here about the number of students in the student center and other public spaces who don't wear a mask. And that is something we do observe pretty frequently. Students who are playing pool or lounging in the student center. I know that Dr. Latham just reported that they're going to text the students and remind the students that it is enforceable and that they should be wearing the mask whenever they are in public spaces. And certainly when I see them in the student center, I remind them you should be wearing a mask, hopefully with the dispensers for the mask that are being installed now. It'll be easy enough just to hand them masks. So we just have to remind students that there is still a mask mandate in effect on campus. Let's see. There's some people, one comment about, do people plan on wearing a mask for the rest of their lives? And again, I think that there's going to be a process of people learning to live with COVID. Email reminders about the mask mandate. Okay. One comment here, it was mentioned that vaccine protocols may change in the future. It is important that UDC takes into consideration that it is important that recent data from the CDC shows that 25 out of the 29 weeks reported in 2022, there were more recorded COVID cases per week among the vaccinated than the unvaccinated. In addition, the data also shows every week after the third week in the March of 2022, there are more COVID deaths per week among vaccinated than unvaccinated. This comment is not meant to discredit the effectiveness of vaccine. Just want to point out that the data makes it difficult to justify the vaccine mandate. Okay, and there's a link in the chat. Personal preference. Chief Colmer posted the link for the information about the expiration on the test kits. Campus cleaning protocols. Mr. Dusan posted where you can get information about getting more information about cleaning protocols there. Okay. And I think healthy debate there. I think that's most of the questions. Ms. Bassett mentioned reaching out to Perkins Management, reminding all of them who are serving food that they need to wear masks. Okay. Okay. And if there are any other questions or comments from anybody on the panel, any other suggestions, reminders, guidance? I think the communication about the water break just went out, so we can check on that. Any additional updates, final words? So, like I said, we will make a few updates to this presentation. Please, I think the link to the survey is in the chat now, so you can click on it. It's one of the last comments in the chat, and you can take the survey. I know that UDC Communications is also going to circulate the survey, so please complete the survey. It'll be available. It'll be available probably for the next month or so. We will only have these town halls, again, the shifting realities of living with COVID. We will probably only have these town halls about once a month, unless there is a shifting reality with the virus, right? And who knows? That's one of the things the virus has taught us, that you just never know going into winter months, going into flu season, what might happen. But right now, we're not scheduled to have another kind of COVID wellness town hall, probably until sometime in October, early November, okay? But please take the time to complete the survey. Ask everyone you know, students, employees, to complete the survey. We really want to know what the sentiments are, what is the prevailing. We know there are going to be a lot of differing opinions out there, but we need to get a sense of what the prevailing sentiment is and have a sense of what direction we need to move in for the spring. Mr. Dusan, Alex, Mr. Bako, either one of you have a final word? No?
No, I just want to add that the mask mandate is also extended to our contractors. So everybody that students coming to the university and working at the university, we ask them to also wear masks.
I was just going to say it's not either or with the vaccination and mask. I mean, they're compound protectors, and so if you're doing both, you're doing the best you can for yourself and for others around you.
I would just add, we look
Oops.
forward to seeing everyone at fall opening convocation. And on the matter of the mask, it's not about personal preference. It's about respecting the needs of the entire community. And so the mask mandate is what it is until date.
Wonderful. Well, thank you all for your participation in this meeting. This presentation will be posted on Rise, and we will also post the chat because I think the chat contains a really interesting, healthy debate and representation of the differing opinions of our community. I'm sure we will see that reflected in the survey responses. And please, everybody, go check the communication about the water main break. Stay safe. And if you are in one of the buildings that has been affected by the water main break, I think you need to probably prepare to work from home for the rest of the day. So thank you all for your participation and enjoy the rest of the day.